Okay.
Are we ready to start?
Yep. Tom, I don't know if your microphone's on, like you sound kind of far away. I don't know if it's just me.
Oh, okay. I can talk up. Is that better?
Yeah, it's a little better.
I don't think I have any. I don't think you're in that. All right. So good evening, everyone. Welcome to the June meeting of the Regional Council. Thank you for attending. The only things that I have by way of correspondence are enforcement notifications and award applications. So we will read those and go over those at the appropriate time. So we'll move into officers' reports. For the chairperson's report, first, let me apologize again for the April meeting and the poor connectivity that I had. I didn't realize that I wasn't going to have such good service in North Carolina. Hopefully that will be better tonight. And also, as you can have probably figured out, I am at work tonight. So in the event that I have to go out on a call, Jen Gutman will assume charge of the meeting. And those are the things that I have right now. Vice Chairperson.
I don't have anything at this time.
Thank you. Treasurer.
Sorry, Charlene Hines here. I have nothing to report for this month. Nothing coming in or out.
Very good. Thank you. Secretary.
No, I don't have anything at this time.
Very good. And past chairman.
Nothing to report.
Thank you, Ed. Good to hear your voice. Let's move into committee reports, beginning with REMAC.
The last REMAC meeting was canceled, Tom, so there's no report. I believe the next one is it later this month, Alicia? I forget the date.
Yeah, it's June. It's either next Wednesday or the Wednesday after. I'll have to pull up my calendar and look.
Very good. Any questions for Dr. Walters on behalf of the REMAC? Very good. CMAC, I believe some notes from Mickey have been attached and for you to read. Is there any additional, Mickey?
There's just a couple of things. Probably the most important thing for our providers is that masks no longer have to be worn if there is no patient in the vehicle.
Can you say that again?
Masks do not have to be worn if there is no patient in the vehicle.
Okay.
The other thing is during the Senate meeting, someone received information that the legislature had passed that EMS squads could carry blood. Don't know the details. It was kind of dropped in the last couple minutes of the meeting, so we'll see what comes of that.
Miggy, I believe that legislation was for air medical to carry blood. I don't think it applies, that specific legislation, I don't believe applies to ground ambulances, but I could be wrong.
Yeah, it was kind of just dropped in the last couple minutes of the meeting, so I'm not sure what it means.
You are correct, Dr. Walters.
Any questions for Mickey regarding CMAC and SEMSCO?
Tom, I have a couple of things. I know they're in Mickey's report, but I want to bring up just a couple of highlights real quick if you don't mind.
Absolutely, go ahead.
Yeah, so the Bureau did discuss a couple of things. One is that they are working on a set of disaster protocols in the future, so nothing that exists now, but looking at some of like the protocols we had during COVID that were of use. I think they're looking at something around like maybe even as many as like 10 of these protocols that could be emergency destination treat in place or things like that, or some of those like the viral pandemic protocol that we had that would be able to, that a region could turn on by like REMAC REMSCO area if needed for disasters and things when they happen in the future. So that's something that they're working on. There was a lot of discussion about community paramedicine, which now is allowable only under the executive order during COVID. And when that executive order expires eventually, then that will go away for now. But I think they're seeing a lot of success, most of it related to using community paramedicine to help with vaccinations, although it's not limited to just vaccinations. So I know they've had, I think, 50 that are doing that. The other thing that may be of interest for some of our agencies is that there is a iGel supraglottic airway pilot project for BLS providers that has been was passed by the CMAC and commissioner approval and some other things as far as the education and some other nuances to work out. I believe that may not be limited specifically to iGel, but may actually include other supraglottic devices and would be something that agencies across the state could enroll in to allow BLS providers to receive this education and be able to place supraglottic airways in cardiac arrest only. And then there was also some discussion on the new protocol. If you haven't seen, it's MURU, M-U-R-U, I believe it is, which is where the state protocol app will be. Once you register online, you put in your zip code if you haven't done it, and it will, kind of already links to the appropriate, like in our case, collaborative protocols based on region. So as time goes on, the prior collaborative protocol app, I do not believe will be updated, and I believe everything will be put into this app as we go forward. So that's something to be aware of. I think there's some other things that Mickey spelled out, but I think that you can probably read those minor things. I think those were most of the big things that I saw, unless anybody else remembers anything else.
Dr. Walters, I just have something to add about the MURU app. We have been looking into it more because we know the state is sponsoring this and everything. We did find out that the current app, how it is now, to include the search function, the protocol finder, and the dosing in the app, that is a premium feature. And those premium features they don't have a set end date at this point, but they said that at least towards the end of the year that will continue. And then moving forward, if you want to keep those features, such as search, it will be $8 per month per provider. So it's a decent cost. So it's something we're definitely looking into. And I know Donna's been talking with Susie from Central about the collaborative protocol app, and how the only thing that one doesn't really have is the dosing. So we're just, still looking into that, because that's going to be, if an agency takes on that cost, that's going to be quite a cost. So it's definitely something that we're looking into.
Thanks, Alicia. I didn't realize, I'm glad you brought up that point about those features expiring whenever, I know they allowed them, or they gave them away for free during COVID, but so it's $8.
It wasn't very clear.
And it's $8 per provider per month?
Correct.
Wow.
So $96
that might cost me more than
per
Netflix.
year. Yeah. Donna did a additional demo with I think his name's Steve, the CEO, and he kind of glazed over. Yeah, Dr. Bart was also on that call. And he kind of glazed over the fact that these features were going to end. I know Dr. Bart was super excited about the dosing feature, but if search is a premium, searching shouldn't, I feel like that's kind of like a standard function of an app, but search is a premium feature, which will require the $8 per month per year. So just something,
I'm not-
we're looking into it, but
Yeah, I mean, I agree. Searches shouldn't be a premium function, number one, but number two, just that cost. I mean, if you had to pay, I don't know, $8 a year, maybe it wouldn't be as big a deal or something, but that seems kind
yeah,
of
I misread it at
This-
first.
This, when I was talking to Joe Bart, like City Fire or Buffalo City Fire would be 75,000 a year. So it's definitely, I'm afraid the state may have not did all their research. So we're definitely going to stay on top of this.
There seemed to also be some discussion. I think it was brought up in the meetings that, I think several people voiced an opinion thinking that if wireless protocols, the collaborative protocols, then perhaps they should pay some fee for all the to have it for free. I don't know if that'll ever happen, but I think that was I think there are several people that kind of
This is Mickey. The only other thing I wanted to mention is Todd has been named as my alternate, and he did sit in on all the committee meetings and such with me, so he could see the lay of the land and be ready to participate should he have to step into my position.
And the next meeting will be in October, they stated. They didn't say a date, and they're hoping that it will be in person for the members.
Very good.
And Tom, remind me if I guess I might be, maybe I'm not remembering the right committee, but I think we had a discussion at this council about some of the issues with reimbursement and students not taking their EMT exam, for example, in a timely fashion right after the class. Did we talk about this here, or am I confusing that with another?
No, that was
Yep.
here.
It was here.
Yeah, Bobby
So-
brought it up at the last meeting.
Yeah, so that was discussed at the state council meeting and at training and education too.
Yep.
And there were some, I don't think there was any outcome of that, Mickey, because I didn't see all the training and education meeting, but I think that it was something that they're at least looking at and talking about, maybe requiring someone to take a test within a certain time frame, even though you have up to a year to be certified, which is based on the regulation, I believe.
What they were going to look at was to talk to legal and see if, as part of a course sponsor's policies, if they could say take it within a certain amount of time, or what a consequence would be. I know one of the areas, if they don't take it within, I think 60 days, they get a bill for the course. So, but all that was going to legal to see just what recourse sponsors had to get students to take it, so they would get their reimbursement, and students would have a better chance of passing, because the longer they stay out of class and don't take the test, the less chance they have of passing.
Dr. Walters, I know Bobby's not on the call, but maybe you could relay the information to him. I know he said at the last meeting that he was going to go back and look at the recent classes to see if they're experiencing a lot of people not testing. And I would think that information would be helpful to Mickey and the education and training, if we had, because that's really the only class that's, Jeff and I don't think Bonnie's on, but if Allegheny County has numbers, but if there's numbers to support the issue, then definitely would want those.
Yeah, I'll follow up with them.
Well, Alicia, last
Mhm.
I had actually checked the numbers with Sue Campbell, who is the CIC for it. We had nobody that didn't.
Okay, so
Everybody,
everyone tested.
we stay on top of them to make sure that they do.
Okay, well, that's good to know.
All right. Thank you all for that report. Any further questions for regarding CMAC or SEMSCO? Very well. Let's move ahead, Alicia, with the STEMS report.
sorry, I got muted. I sent out my report to everyone, so you guys can take a look at that. Just some of the highlights. We celebrated EMS week in mid-May, so thank you to everyone who stopped by Olean General and saw us at the cookouts, and also went to Jones and WCA or All-Star for the different cookouts. It was great to see so many people, and thanks to all the volunteers that came and helped cook hot dogs. It was a fun time, and it was nice since we didn't get to do it last year. You guys probably all saw in my email, Southern Healthcare System is currently working with the Feed More Western New York on their Spread the Love peanut butter drive. That drive is on Saturday, and we are collecting peanut butter at our office. And right now, Donna's challenging the EMS agencies to donate peanut butter, and the agency that donates the most will win a $50 Amazon gift card. So we've received, a lot of good support for that. So we're excited that we're being able to do that. We are also currently hosting an EMS leadership masterclass. It's a 5-week EMS series that Lisa and Robbie from EMS Leadership Academy are teaching for us. That's on Zoom, and the first class was last night. So we're excited that we are able to be doing that currently. And then lastly, we're working on the Southern Tier EMTB Academy that Donna's talked about in the past, where we'll run a academy style EMT basic class, and the students will be able to be stipend to attend. So we're currently taking applications for that, and the information's on our website. And that's all. Those are kind of the big highlights. The EPCR, I'm still working with, all the agencies have been really great and working with the transition to the EPCR. So we're working on that diligently to get everyone live by the end of the month. And then the state did update the EPCR schematron on Tuesday, and some agencies have experienced certain chart failures. If you're under the STEMS command, I was able to make the necessary changes that were needed to not experience those errors. But I've received contact from 2 agencies and got them in contact with Adam at EMS Charts, and he was able to take care of their issues. But if anyone's having any EPCR issues due to the schematron update, if you could just email me, that would be great, so I can provide that information to Peter. That's the end of my report.
Any questions for Alicia? How many applicants do you have for the EMTB Academy already?
I don't have that information on me at this time. We did contact all the local school districts for maybe students that are maybe not necessarily not on the path to college, but maybe are seeking employment after high school, that kind of thing. Donna's worked with the workforce investment boards to give them the information. So, we're not trying to have a lot of people in the first class, but we're seeming to get some good feedback. Brian's been working really hard to drum up interest, and he's setting up at Strolian on Friday, setting up a table. So we're excited.
So am I. I'm interested to see how well that goes. I also have a very small amount of satisfaction from the fact that you were muted, since you are the person with control of the mute button.
Well, I think Jeff Lucky's message popped up in front of my mute button, so I was trying to get it to go away so I could press unmute. But yes, I was.
Thank you, Alicia. Department of Health, any report?
Yeah, I'm having audio issues, so I'm not sure. Can you hear me okay, or?
Oh, wow. I can. Better than some.
We got a miracle. No, as we move a little bit, hopefully beyond, COVID activities, we've got one staff member that's still fully deployed with the military, and I just got my second staff member back from his state assignment, and I've been, the FEMA sites have closed, so we're trying to, right now we're prioritizing on our office move, which is going to occur on basically July 1st. We're moving to 295 Main Street. The website will be updated at the appropriate time, but that's rapidly approaching. And then we're reprioritizing our casework, our our upcoming agency inspections, sponsor audits, and all the other components that realistically we've been behind on. And the only other thing is, if Dr. Walters, could you post your Netflix username and password for everybody? Maybe we could have some cost sharing opportunities. I'm sorry, just joking, Pat.
Hey,
but
any way that our providers can afford the state app that you've mandated, yeah, I'm just happy to help out.
Not that to the Miro app or something. I don't know, but no, I'm sorry, I'm just joking. But if anybody's got any questions, I'm glad. I think everything statewide has been covered between Nikki, Dr. Walters, etc. And if we have missed anything or failed to follow up on anything, it has been somewhat of a unique year for everybody, year and a half, whatever. It seems like 10 years, but please let me know if there's any agencies that are struggling or having issues or have needs from our office. Please feel free to reach out. I feel bad that I was talking to Alicia actually this afternoon, and it was like we're short staffed, and I'm not making any excuses for that, but I really haven't had the opportunity to travel down to the Southwest District in a bit of time, and I feel bad for that. But we hope to. I hope to get out there very soon once we get a little bit unburied and interact with agencies and to follow up on the stuff that we've had gaps on. So I thank everybody for their support, and if there's anything that you need or I can assist with, please let me know. If you've got questions, I'm glad to answer. Thank you.
Hey, Ed, I do have one question, if maybe you can comment. I was just looking, and maybe I missed this at the CMAC and the SEMSCO, because it was a bureau policy that was just put out. It looks like it's dated the day before the CMAC SEMSCO committee meetings. But it's about submission of PCRs on July 1st, and I think everybody knows about the transition and Alicia mentioned. One thing that kind of struck me in policy is that it does require all agencies to complete their PCRs within 4 hours of completion of the call. And I think that that's something important for agencies and providers to be aware of.
Yeah, I think I would add one thing, Dr. Walters. There was a lot of discussion on that. Alicia, you were on the program agency call, certainly Donna too, the other day. And Peter's response was that, that also says that it's 4 hours 90% of the time. And one of the questions that Director Greenberg asked was, okay, how are we currently measuring that? How are we going to measure that on a go forward? And Peter is developing a mechanism to sort of develop some reports on that so that the program agencies can run it, they can do a system analysis and provide feedback to the agencies and the support. But some of the conversations that he had pertaining to it that agencies had brought forward their concerns, they said, how many calls does your agency do? And typically you're doing it either at the hospital when you arrive at the facility, or if you're getting sent out on another job right away, what is the percentage that actually occurs, and how many of your calls do you actually do back at the station? So I think that people, 90% of the time you've got a 10% sort of fudge factor there related to the ability to make that happen. And I think the good thing about it is that they're going to try to measure that, try to come up with the data and do a statewide comparison on it, and then probably reanalyze it. But that's what they came up with at this point. So did I miss anything, Alicia, that was talked about on the call? I know it was a sort of a hot topic for a bit.
No, I think you pretty much covered it.
Thank you.
And so Ed, are you going to be beginning to do like in-person inspections and certification, ambulance reviews and like that again?
Yeah, we'll be. I'll say this: we're just starting to reprioritize and look at where we're at now. Our objective has been to align, statewide, align our ambulance inspections sort of with the agency renewals. and do it on a 2-year basis. But we're years behind on meeting that objective. But we are going to sort of reprioritize and schedule agencies. One of the things that we do is we sort of analyze agencies that may have had deficiencies and maybe look at prioritizing them over agencies who've been consistently compliant for many, many years, and those kind of components of it. But we are certainly going to get back to in-person agency inspections. I don't have anything scheduled. I do share once we schedule inspections, I do share that information with the program agencies, and try to give the agencies plenty of notice. And obviously we have flexibility related to working with the volunteer entities as to what their availability is and those kinds of components. So and we send them out the check sheet as to, hey, here's everything that you need, and if you have questions, let us know in advance. But we aim to get obviously compliance and to improve system performance and compliance. So that's the kind of the objective. But Tom, I currently have nothing officially scheduled at this point. Again, we're focusing on our office move, and then looking at all the work that we technically should have been doing for the last year and a half here, and so we're just behind. Plus we're a bit short staffed, but no complaints here.
Ed, I did think of something when you asked me if I thought of something. I'm sure everyone saw my emails, but the state is as kind of like a extension of Vital Signs Academy and the Vital Signs Conference. They have 2 days coming up. They're having one for educators and one for leadership. So I did send that information out, but you can find it on their website. So that's a great opportunity for different education that's all virtual. So I just wanted to throw that in real quick.
Thank you very much.
Any other questions for Ed?
Sure. Following up on the 4-hour completion thing, how's the state coming on getting the timing of getting the EPCRs then to the hospitals?
So Doug, I can speak to that real quick. The EPCRs do go directly through to Hospital Hub when they are transmitted to the state. So after the chart closes, it does automatically go. And there's the platform through ImageTrend called Hospital Hub that the hospitals have access to. In addition to that, you're not going to be using EMS charts, but a lot of the EMS charts and the ESO agencies, when they close the chart, it automatically gets faxed to the hospital as well.
Thank you. I just seem to recall from past meeting that link wasn't there yet for all the hospitals.
Yes, there was the question a couple months ago since currently the charts go to the Western Elite site and then to the state's site, whether or not your agency that will be doing direct entry will get to the Western site. And Peter did end up figuring that out. So that will be happening. And I know Priscilla's on the call. I gave access to all the hospitals a while ago. If they're not using it for Hospital Hub, they can contact me and I can get them access pretty easily. I know Olean General uses it quite a bit. So, and the nice part about that is all the vendors go into one place rather than having an EMS charts login and an ESO and all that. So, but yes, sorry to step in on your answer, Ed.
No, that is actually perfect. But I know that from the state, Doug, the state's focus is to in a sense, do our best to get that data to the hospitals as promptly as possible. So obviously, there's varying degrees based on which EPCR platform you're on and those kind of components. But exactly what Alicia had said is that I think they're doing everything they can to focus on getting that to the hospitals as quickly as possible, because the data is critical. The data is not only critical to EMS, it's certainly critical to the hospital and the ER staff and certainly all the other specialties. So thank you, Alicia.
Thank you, Doug, for that follow-up. And it just wouldn't be a meeting if you didn't have a question for Ed Major after his report. So thank you for your consistency. Let's move ahead to our council committees, beginning with community relations. Hearing no report.
Sorry, Tom, I couldn't find my mute button. I have no report.
We're going to have to ban alcohol at these meetings. Only fooling. Thank you, Ed. Education. Mickey, anything?
Just a couple things. Alicia mentioned the educator and leadership virtual presentations that are going to happen. Vital Signs Academy is still doing 3 presentations per week, and Alicia has kindly sent out that schedule for everyone. We did have a brief discussion about our conference for the fall. Biggest stumbling block at this point is a venue. So it's in the talk stage, more to come. That's it.
Very good. Thank you. EMS services. Brian was unable to attend, and he did send me this email. The only report that I have for the services committee is that the transfer of authority for Little Valley has been sent back for revisions. So that is his update from services. Legislative. Hearing none and giving an extra second for someone to unmute. We will move along to membership. I know that Dan Imfeld is on a call and is hopeful to join us.
He actually joined us.
I'm here now.
Yep, he is here now.
Welcome, Dan. Any report?
Yes. Just a reminder that folks, if they want to nominate an alternate, they can do so. We have probably fewer alternates now than we've had in the past, so I encourage folks to look at that. And then under new business, County Council will be recommending somebody to fill their open position. That's all I got.
And just like that, I talked with my mute on. Let's begin with county reports with Allegheny County, please.
We did finish up our EMT class. I believe there were 17 that finished up the EMT. Planning for classes in the fall, an advanced class plus EMT. And we're also kind of sad to announce that Sue Campbell is at least taking a break from teaching. She resigned, but she's welcome to come back at any time, but she needed a break for a little while from teaching. So we'll strive ahead without her, but we're grateful for the years of service she's given to us and the students that she's affected.
Certainly. Well said, Jeff. Any questions for Jeff at Allegheny County? If not, Cattaraugus County.
I don't think Bobby or Baker are on. I think they've been busy continuing with helping the health department staff vaccination sites. I think has been the biggest thing. Otherwise, I don't think there are any major issues other than some routine emails that have gone out. But I don't think there's any other major things that need to be discussed at this meeting, Tom.
Tom's frozen.
I thought it was just me. I'll text him. Well, I'll call Chautauqua County while we try and get Tom set up. Any report from Chautauqua County?
Yes. Basically, we have a BLS skills fair on 6/23 at the Mayville Office of Emergency Services on 6, and the flyer for that is out. Alicia sent that out earlier. 6/17 and 6/24, we will be doing CCEMS ALS providers and volunteer ALS providers. We will have a flyer out for that sometime in the next week or so. Been working with Alicia on a database for all our squads, which is actually going to give us a lot of information in one spot, whereas right now it's kind of all over the place. And anybody else from Chuck kind of have anything to add?
Asheville's going to do a Narcan class on June 12th.
I think that's it for us.
Tom is rejoining right now.
There, am I back?
You are.
All right, I switched to my phone. I heard you finished with the Chautauqua County. All right.
Yes.
If you can give me just 1 minute, I'll be right there and we'll begin the formal part.
Do you want me to take attendance while you do that?
Attendance, please. I just have to help pull the helicopter in.
Okay. All right. I'll just go by the counties. Kay Bushman, Jessica Gaines.
I'm sorry, what was his excuse?
He has to pull the helicopter in.
Okay, I just wanted to make sure I heard that correctly.
Is that Ryan's voice? Hi, Ryan.
That is, hi everyone.
Hi. Yeah, he's working tonight at Mercy Flight, so they got to pull the helicopter in.
I've heard a lot of excuses, but the answer of pulling a helicopter in wins. I mean, I haven't gotten that.
Yeah.
Better than AAA.
Jessica Gaines.
She's on here.
Okay. Scott Lamphere.
Present.
Dan Marsh.
Here.
Terry Parker.
Present.
We had no Toms here. May Stottlemyre.
Hello.
Maggie Thompson. Bonnie Van Housen, alternate Jeff Lucky.
Yeah, and I could ask, I didn't see Maggie out there yet, but Kay, we're doing our skills tonight. So that's where Kay is, and I assume Maggie's out there as well.
No,
All right.
Maggie had some other issues going on tonight.
Okay.
And then Paul Weaver was unable to attend as well. Chris Baker, Dorothy Button.
I'm here.
Mickey Fornes.
Here.
Ed Fredrickson.
Here.
Bobby Kuhn. Carrie Parr.
I'm here.
See her. Hi, Carrie. Brad Petrozewski. Todd Reisner is on vacation. Tim Richardson.
Here.
Dr. Walters.
I'm here.
Okay. Priscilla Baines.
Here.
Thank you. Doug Conroe.
Here.
Jen Gutman.
Here.
Dan Impfeld.
Here.
Bill Johnston.
Here.
Laura Logan got stuck at work unless she Brian Wilcox also not able to attend. Guests we have Donna Kame, Dr. Lamont, Ed Major, and then Ryan Greenberg. Is there anyone else on that I missed?
I'm here, Donna Bryant.
Oh, thank you, Donna. You're listed as an alternate because I know
Right.
that's going to come up later, so I will mark you. All right,
All right,
thank you.
And Alicia,
Alright,
I got,
Tom.
since Ryan's on, I got one more thing that I forgot to say about Chautauqua County.
Okay.
I know it's near and dear to Ryan's. Chautauqua County now has somebody that's applied for community paramedicine.
Yay! That's awesome.
So
Yes, I believe both All-Star and Chautauqua County both have been approved. Or Chautauqua County.
CCEMS. Yep.
Yes. Yep. CCNS. Yep.
That's
All
awesome.
right, very well.
I do think we have, if I remember correctly, I think there is still a county or two in your area that doesn't have. So
Yes,
let me know
I
who you
believe
need.
Cat and Allegheny don't.
Allegheny's holding out for the CCs to be part of the community paramedicine program.
Sure, Scott. Likely excuse. Still sunsetting in 10 years. Good pitch, though. Good try.
But what an incentive to get the CCs to move if you included them now.
I'm willing to have a conversation if there was, movement now. No. Unfortunately, it's through executive order, so it's not even something I can wiggle on that one. But I do know, Scott, that I believe when we spoke, what is it, like 30% of your staff is already paramedics, right?
We're moving.
Yeah, so I think it's about 30% of your staff. So you can just have that percentage of your staff do paramedicine, and the others can, fulfill other duties as needed to balance the two and allow you to have your community paramedicine.
Always thinking for us. Always thinking.
All right. So, Alicia, we officially have a quorum.
Yes, Tom, you do.
Thank you. So let me officially call this portion of the Regional Council meeting to order. And we have established that we do have a quorum. So we will continue to forge ahead. We will seek approval of the minutes from the previous meeting with or without corrections. Anyone, and again, let me remind you, if you make a motion or second, please state your name so we can have record of that in this format.
Bill Johnston, so moved. Scott Lancer, second.
Very good. We have a motion and a second to approve minutes from the previous meeting. Any additions or corrections from anyone? Carrie Carr. I see your hand raised.
No, my finger was just sliding over the computer. Just wanted to say hi.
An old-fashioned wave to you, Carrie Carr.
You got it.
All right. In that event, so let's all those in favor, raise your hand or say aye for approval of the minutes.
Aye.
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 We'll give you a second to clear that off. Any opposed, the same. Very well, the minutes are passed. Hopefully in the roll call, May got credit for at least 3 people attending the meeting. Any official treasurer's report?
May, you're muted.
There you go. Nothing came in or out last month. There's nothing new to report.
Very good. Motion to accept the treasurer's report.
It's Mickey, so moved.
And the second.
This is Carrie. I'll second.
Very well. All those in favor, raise your hand, say aye.
Aye.
Aye. Aye.
Very well. And opposed, the same? Very good. Treasurer's report is accepted. Thank you. I do have some enforcement notifications. This side of my computer is still working, so here we go. Gerard Boettcher, Boettcher, from West Hempstead, New York. Surrendered effective 3/31/21 for violations of Part 800, 15A1, 15A2, 16A2, 16A3, and 16A11. Brendan Boose, Boose, from Rochester, New York. Suspended for 1 year, effective 4/4/21. The suspension is stayed. Placed on probation for 3 years, effective 4/4/21. Assessed a civil penalty of $2,000. Joseph Oakes, Oakes, Edison, New Jersey. Suspended for 1 year, effective 2/3/21. The suspension is stayed. Placed on probation for 3 years, effective 2/3/21. Assessed a $2,000 civil penalty. Violations Part 816A 2, 9, and 11. And finally, Keisha Brockington, Staten Island, New York. Revoked, effective 5/21/21. Assessed a civil penalty of $2,000. Violations Part 816A2. Those are the enforcement notifications that we have received. We'll move to old business. After our last meeting, I did inform Dana Jonas that any correspondence regarding the CCEMS appeal should be directed to me. I received his reply, and I have heard nothing else since then. We did have discussion at the council regarding reaching out for some free legal advice if possible. At this time, I have not made connections with that person. I will continue to do that. That is not because of his fault, but because of on my part. So I'll continue to reach out to him and see what advice, if any, he has for us. But at this point, Dana is aware that any correspondence should be sent to myself, and I have heard nothing further. Given the pace of appeals, I didn't expect to be honest with you. But
Tom, a question. If you haven't heard anything from them, do nothing, is my advice.
And I am very content with that. And I understand that this process can be greater than a year easily. So we will continue to leave it on the old business so that anything that does come up is brought to your attention. If something important enough comes up between meetings, we'll share that with you through our emails. But that is where we stand on that. And to my knowledge, there is no other old business unless someone has more old business. Any further old business? Old business. Very well. Let's move ahead to new business. And I had nothing listed on the agenda, so I will turn the floor over to Dan Imfeld on behalf of the membership committee.
Dan, if you're talking, you're muted.
Alicia, is Dan still on?
I see his name on the list. I just texted him.
Tom, it's Mickey. Before we get Dan, Brian Walters and myself both need letters of renewal to me to the state council and him to the SEMSCO. Our terms expire at the end of 21.
So moved. It's Terry Parker.
Very well. Is there a second?
Scott Lancer, I'll second.
Any discussion on reappointing Mickey Fornes and Dr. Walters to state council? All those in favor, say aye.
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 I'm back.
Very good. Opposed, the same, except Mickey and Dr. Walters. All right. I trust, Alicia, that you have the address and the contact information that I should send these to.
Yep, I will do it.
All right. We will take care of that. Dan Imfeld, go ahead on membership committee.
I'm sorry about that. I moved to the other end of the house and I lost my ability to talk to you. Anyway, we have an opening for Chautauqua County. It's Steve Cobb who resigned. We took that to the Chautauqua County Council. They have put forth the name of Donna Bryant. Donna is a member of Lakewood Fire Department and the county hazmat team. Donna was with Starflight when they were in existence, and she's been an ICU and an ER nurse. So I guess I would make the motion that we accept the county's recommendation and we appoint Donna to fill that open spot.
It's Mickey and I'll second.
Very well. Any discussion on the nomination of Donna Bryant to join the council representing Chautauqua County? Hearing none, we'll proceed to vote. All those in favor, say aye.
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 And opposed, the same. Welcome to the council, Donna, if you are still on.
I am still on it, and thank you very much.
Now you can appoint your own alternate. All right. Any other new business that needs to come before the council? Any other new business? Very well. Regarding next
Tom?
month, yes.
You have the award.
Oh, thank you very much. We have received an award nomination for one of the state EMS awards. Let me share that with you. This is an application for EMS Agency of the Year. It is for Weston's Mills Fire Department, Kinney Hose Company in Weston's Mills here in Cattaraugus County. Let me see if I can I will read you the reason for award nomination. The Kinney Hose Company continues today to proudly respond to an average of 230 EMS calls with minimal help from mutual aid departments or commercial ambulance service. They maintain volunteer, paramedic, or ALS coverage on most responses. Utilizing electronic charting with a strong QA process with an active medical control physician. And then there's a bit about their COVID-19 response and the fact that the department also has technical rescue, firefighter rehab, and water rescue response unit in association with EMS. Looks like it's a well-written application. I don't know that we need a vote, but is there an affirmation that we should send this on to the state for the award of EMS Agency of the Year?
It's Mickey
Tim Richardson, so moved.
All right, I heard Tim and Mickey both make motions. One can get credit for the motion, one for the second. Any discussion?
And Tom, I can send that out if people want to look at it.
Yeah,
as well.
I think I read about less than a third of what is written as far as background, reason for award, and contribution. So yeah, I think that would be good to send out a well-written application.
Okay.
We have a motion and second. All those in favor of sending this application for award onto the state, raise your hands, say aye.
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 Tom?
Any? Yes, sir.
When you're done, I got one more.
Very well. And any opposed to sending the nomination on? Very good. Yes, Alicia, if you will send that out to the membership and we will forward that on to the state. Go ahead, Dan Imfeld.
Yes, I got one more from the membership council. I knew I shouldn't have gone on that call. I'm just not organized here yet tonight. But Alicia reminded me, so thank you. We do have another one from the county, and that's Tim Carlson to replace Ron Hassing. So I would move that we accept Tim Carlson. He's been with All-Star in the past. He's with CCMS now. So I'll make that as a motion.
Very well. Is there a
Second, Bill Johnston.
Seconded by Bill Johnston. Any discussion on Tim Carlson representing Chautauqua County on the council? Very good. All those in favor, please say aye or raise your hand.
Aye.
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 And then along with that, I've got a letter from Tim appointing Noel Gutman, the Director of Emergency Services, as his alternate.
Very good. That requires no vote on our part. That is for information only for
That's correct.
the
Yes,
council.
just information only.
Correct. Thank you. All right. Any other business to come before the council?
Mr. Chairman, Scott Lanfear.
Yes, Scott.
Just the fact that Ryan's with us tonight, can we discuss the cost of the app that may be forthcoming? I think that's going to be a substantial cost that a lot of people may not be able to shoulder. And maybe we could get some insight or conversation started now.
I think that falls under the purview of new business, since we just learned of it tonight or earlier in the informational meeting. So I think that's appropriate if Director Greenberg is interested in commenting.
I apologize. I'm not able to comment right now. I have to go pull a helicopter in from the outside house here. No, so I think it's important to understand that the app will always have a free version, like that the partnership version, which includes all the protocols, all the policies, the hospital information, you know, but essentially everything that you can get on our website, but in the convenience of an app, will always be free. The additional version, whether it be by a provider who chooses to upgrade or an agency that chooses to upgrade, or we've had questions on regions, if they can get a grant to upgrade, you know, that becomes up to those individuals. And I think it's important to know that that's, you know, always the case. There will always be the partnership version. The partnership version is free. It is only the additions, you know, of if somebody wants to do more. At the BLS level, the additions on what's on there, yes, it makes it easier to search or do certain things, but it's not as big of a significant difference. At the ALS level, there's definitely some things that are very nice. You know, there's the drug calculator, there's the ability to search for medications and contraindications and things like that. And that is where we're looking at some of our, you know, where some of either the agencies or REMACs or REMSCOs who want to use different funding sources or grants or whatever, who may choose to upgrade for their providers, is, you know, working on if they would choose to do that or not. So there's two pathways there. I think it's important to know, again, it will always have the free component, and then let's look at the other side. So, you know, if we look at our ALS providers statewide, we're, you know, somewhere around 7,000 paramedics and another 15, probably even less now, probably 1,200 CCs. So, you know, we're looking at maybe, let's best guess it's somewhere around 8,000. About half of those are in New York City, if not more. It's just the nature of, you know, where they reside, a pretty significant amount in the Nassau-Suffolk area. And then obviously the rest of the state fills the rest. And so, you know, if you were to really look at, and maybe, you know, do you know how many ALS providers are in your region? Where's Alicia? Alicia probably knows the number.
I don't have my spreadsheet on my home computer, but I could look that up.
Best guess, Alicia.
But 600.
Yeah,
600.
Okay. So, you know,
that's probably a high estimate.
That's
right.
Life, yeah.
And then I would also say, you know, how many of those are actually practicing, so on and so forth. You know, it really rattles down. And so, you know, that's where it becomes the determination of, you know, if they need it, if they want it, if they don't want it. The protocols will always be there. The policies will always be there. The hospital notifications will, you know, hospital information will always be there. You know, some of the other things that make it more convenient, like the drug calcs and the other things, they're enhancements. And that is up to an individual agency or an individual if that's something that they feel they need or want.
See, Ryan, it's Mickey. I have a question. Do you think that some negotiation could be had to purchase that upgrade for the first upgrade, not the big upgrade, but the first upgrade by a region? And could that be some discussion for negotiation rather than $8 a month per person?
I mean, they're a private organization. I think anything is possible. I think particularly, you know, obviously the larger number of bulk purchase or something, you know, would be an option, but I can't speak on behalf of them. You know, that's not the route that we took on what we chose to put for the partnership version and what we partnered with them for that. But I do know that other regions are looking at that. And so I'd absolutely, Steve Blocker is their CEO, and I would say reach out to them and speak to him directly on that.
Thank you.
But I mean, what's the worst that happens? They turn and say no. Well, then you're in the same boat you are today.
So this
Brian,
is
it's
Donna.
Tim Murchison.
Yeah, Tim.
Yeah. Is it Donna? Is it based on phone, Ryan?
talk over it. If it was Mickey, I was gonna say, Tim, you gotta wait.
Oh, because I'll hear about it tomorrow. So, but is it based on phone, Ryan, instead of agency users? Because my thought is, let's say each ambulance has a smartphone on it. So if you run 6 ambulances, have 6 smartphones instead of 400 providers, you just have, the case for that phone.
So that's interesting. I don't know, and I'd probably say that they haven't thought of it that way. Let me put it this way: I don't think they have. You probably could put a device, and it's probably per device, not per person. So yeah, like if you know that you chart with an iPad on your ambulance, which most of us do now, you probably could get an upgraded version for the iPad and solve your problems right there. Wow, Tim.
That's what I'm thinking.
Change that whole theory. That's a really good one.
Should have this offline before they get to us.
Right?
So he did tell me that they're going to be putting out a discounted rate of approximately 30% for people who sign on early, was my conversation. But that was the only discount they were talking about at that point.
Ryan, just for point of clarification, because I know that there are providers that are going to ask this, is the state receiving any of that $8 per provider per month?
Absolutely not. That's a great question. Nope. Our partnership model is strictly where we're paying for the free component.
Thank you.
Everything else is above them. But it's another great concept, though. Why didn't we think of that? Made some money out of this.
Ryan, is there the ability to, as opposed to regions or agencies or groups going into like a larger scale kind of pooling and buying for a region, is there an opportunity to do that statewide through all the regional councils or all the REMACs in doing that? I mean, I would think that we could probably get some bigger discount if we did something like that statewide. And or, I mean, since this is the direction that we're moving, why doesn't the Bureau just do it for all the providers in the state and work out a deal?
Yeah, we just financially can't afford it. Just budget wise,
Yeah.
we did what we could afford. And then we're, essentially acceptable to the other component. Otherwise we would have. And kind of the same side, some people say, well, why did you choose to have a partnership version versus just building your own app? We've seen some of the troubles of building our own app where we felt that the value of this particular partnership and more importantly, the ongoing upkeep of it was, a significant thing that goes with that. So as far as, bulk purchasing amongst all the groups, that's something that I would say Donna should bring to the other groups and say, hey, what if we were to do this? The state and, our contracting rules and things like that, we wouldn't be able to get involved in the middle of it. But it's the right, I would say it's, especially if you're all thinking along that same lines, like I didn't think that regions were going to be so kind of bought into buying as a region. And I will say the bulk of what I heard is buying for a region for the ALS providers, not as much for the BLS. Scott, in this particular case, I am counting the CCs as part of those critical ALS providers there. If you didn't know ahead of time, Scott cornered me for like an hour on the value of the ECC and how they should be forever grandfathered in. The conversation didn't go in his direction, but so I think there's value there, and like Donna said, hey, look, I guess they offered her a 30% discount. Great. I don't know what else there is. I don't know, if they have scaled things or different features or would make a subscription light plan or more plan. Not sure.
I'm going with Tim's idea, and I'm going to try to sneak through before anybody else finds out.
I thought that, I gotta be honest, that's pretty good. I did not think of that one, but that is a pretty novel one.
That's why he's the chief.
Yeah. I mean, reality is then it's on the devices that you need. If somebody chooses to get it on their phone as well, then they can choose to absorb that cost. That's up to them.
Tim, maybe you can also source a method so that you buy one and then have every other device that you have remote into it, and it's still one. Maybe there's a way to mirror everything. I don't know, just another cost-saving measure.
Other questions for the app or anything else really?
At the risk of invoking your wrath, why is it you count CCs for some purposes but not for others?
In what regard?
Well, you were saying that the CCs are included as far as the calculation for this app.
Yeah.
But not for, other purposes.
No, so the CCs are included in this goes back to Scott and I having many conversations. The CCs in our world, they're an ALS provider, so a CC and a paramedic are at least for the moment are almost interchangeable. There is a difference in the world of community paramedicine and the regs and our ability to get community paramedicine put into place to where they did draw the line and say the national standard is for a paramedic, not a CC level, because the CC level is known.
I understand that part, but what you're saying, your excuse was why CCs weren't included was with executive order, or is it in the regs? Which?
For community paramedicine?
Right.
Executive order.
So there's a way that can be changed.
No, the executive orders can't be modified. And again,
they can be changed by the executive.
They can, but we have not seen any modifications to the executive order since they've been released. And again, that executive order related to community paramedicine specifically, I mean, there were discussions about will all ALS providers be permitted to be part of community paramedicine or not? And it was, it was difficult for us to get that even in to allow for community paramedicine. And one of their stipulations where we wanted to go based on the national standard, and national standards were based on paramedic.
All right, thank you. I understand, but I know that there are significant portions of the state that are served by critical care techs instead of paramedics, and to exclude them just based on that bothers me a little bit, and it might be something to advocate for a change, but that's not for this discussion. That's just for the future.
So I think I think that's one of those things that I don't know. Again, I don't know that we'd be able to advocate for the change related to the executive order, because we also.
I'm not saying you have to advocate for that. You work for the executive. I have to. We're talking about outside of the chain of command.
I think the avocation would be, when we go for permanent community paramedicine, to include all ALS providers, including probably AEMTs, and then really realistically, and look, there are places that have community paramedic programs that have EMTs as part of it, and the EMTs go home and help with telemedicine visits and stuff like that. I think this was our opportunity to prove that community paramedicine holds a tremendous value and can do a lot of different things. I think when we go for statute changes for community paramedicine, I think you have maybe a requirement that the community paramedicine program has to be administered by a paramedic, overseen by a medical director, but can have any EMS provider as part of that program and to help facilitate it.
Thank you. I fully agree.
I am right there with you. It's one of those, you take the small steps to prove things. We got it in on the executive order. It allows us to show our proof of concept in many senses. And then I think, look, reality is, do I need a paramedic to go and do a risk assessment for falls? No. Look, I can tell you, my hospital I used to work for in another state, we had EMTs go out and do fall assessments. And, there's just different things. Sure, there's going to be certain things that you're going to want, whether it be a CC or a paramedic, but an ALS provider who has extensive training to do assessments on. But there's plenty of things in the CP program that don't need to be done by an ALS provider.
Thank you.
Absolutely.
Hope Dr. Walters was listening to that.
Why did I step on hornet's nest on that one?
Yep.
Which part?
On what part?
The overemphasis of ALS that we're getting.
Oh, I don't overemphasize ALS, Doug. I just think that we need to follow national standards and guidelines when we EMT calls. I mean, those are national guidelines. But I totally agree with Ryan that there's a lot of role for basic EMTs in community paramedicine. A lot of things, even, there are a lot of agencies across the country that partner and work with either hospitals and healthcare organizations or county health departments, for example, and they may be doing things in conjunction with a nurse, and they may, be completely well suited to have a basic EMT doing those things. So I think careful talking about, Doug. I don't think it's not overutilizing ALS. I think it's looking at what role we're fulfilling at the time.
Well, the buzzwords that people use, and difficulty breathing. I'm listening to ALS being sent to every difficulty breathing. I think we got to take a hard look at that. Maybe it should be labored breathing. So many times we walk in a door and they're sitting there smoking a cigarette, talking, "Oh, gee, I had a little trouble breathing." But it's that kind of thing where we're, from my perspective, we're over dispatching ALS. But that's
Again, I think that's
different discussion at a different time, I guess.
Yeah, I think we can talk about that offline, Doug. But I think, again, remember, whether it's MPTS or whether it's APCO, those are nationally validated algorithms for that, and you're relying on sometimes third-party information or layperson interpretation, which we know is sometimes under or over, triaging. But you have to the worst and make sure that you're trying to get the right resources there in the shortest amount of time for the worst case scenario. And that's
right.
where it gets frustrating for providers sometimes.
Yep. Yeah. And that this is for another discussion, another time, but the effect that it's having on keeping basics in the system is a growing concern. So, but anyway, it's time to adjourn, Tom.
Tom, it's Ed Major. I did have one other thing that I was remiss in the previous portion of my report. If you could just give me about 30 seconds.
Go ahead, Ed, of course.
Sure. And Director Greenberg certainly add to this, but the Bureau is hiring. I'm not trying to take people from the region by any means, but there is an open district chief position in the Syracuse regional office. So that is, it's been publicly distributed, but I'd be remiss if I did not post or communicate that the Bureau is hiring, and we have an open position in Syracuse. And if there's anybody that you feel should be interested in that and meets qualifications, resumes, I believe, are due Friday. So thank you. And you do get to work for a great boss, Director Greenberg. So, anyhow.
Hate him to say that.
Yeah.
I know they mentioned it before, but I'll bring it up again. There is the Education Day that's coming up. So if you do have any CSCs or CLIs, that is a big one they've been trying to figure out where to get some of their education, some of their mandatory ed hours. So that's an option there. And then for the first time, we're having a Leadership Day, and that's on the 18th. So one's on the education's on the 11th, and leadership's on the 18th for an 8-hour day. And that one will be, if it didn't go out, I think it went out already, but it'll be going out. More information on that one will be going out. You can sign up on the Vital Signs conference page. The last thing, unless anybody has any questions, I did have one other thing based on the conversation I had. I'm just curious to get some feedback on, but I'll see if anyone else has any other questions first. Awesome. So, and I know that one of your counties has kind of a similar model to this related to first response in county-based systems and things of that nature. I guess my question to you is, should there be more models like that with a focus on, and Doug, I think you were talking about our BLS side, where, letting the agencies get to the point to where they can staff BLS without a problem, because we're constantly hearing there's not enough paramedics or CCs, or not enough ALS providers. And should we be going more towards county-based ALS first response agencies partnered with BLS, stronger BLS ambulance transport services and that side of things, or other suggestions in models? And so I was on a conversation earlier today, not for your region, for another region, where they're taking a different approach and feeling, well, if they center the ALS to where the agencies don't have to provide that, and allow the agencies to focus on the BLS and making sure that they have enough EMTs in the system, is that a stronger approach than where people are fighting over paramedics and they're losing a paramedic because the next agency next door is paying $1 more, fill in the blank. I was just curious to see what this group kind of thought of it, as you kind of have several diverse systems or models in your area.
This is Dan Infeld. I guess I'll go first. In Chautauqua County, what we call ours, in the term we've been using, is a blended system, which is the county flight car, a commercial service, a couple of paid fire departments, and then a whole bunch of volunteer fire departments. So for us, I don't think our county could afford a full-blown county ambulance service. So we try to do what we do to fill the holes and fill the gaps, and we're running as a blended service. I do think over time, statewide, it'll probably get more and more towards the county run. Our folks that we've been watching has been Livingston County, and their progression, we've been watching them for probably 10, 12 years, which Ed knows. So I think there's lots of changes coming. Unfortunately, I don't think, well, my department, for example, when I joined 30 years ago, we ran 350 calls. Last year, we were over 800. The year before that, we were 1170. So I just don't know in some of these cases how we can continue with the escalating call volume with what we've been doing in the past.
Interesting. And I think, in New York, we'd always have a blended system of some kind. It's just a matter of what that blended system looks like, and where things fall. And so this was just a different approach, and I was curious to get another perception on it.
So Ryan, I'll say from a medical director perspective, I mean, I think given the amount of calls that we see increasing, over however far back you want to look, like Dan mentioned, and you look at the skill set, the training requirements, the hours of education and things, I don't think you see a lot of truly just volunteer that volunteer have worked full time for either some, whether it's a county agency commercial service or something as a paramedic, or maybe they did in the past and now they've kind of retired or stepped back or took another career. So I think that when you look at it that way, even your volunteer agencies that are a paramedic level, they're relying on a couple of ALS providers who also work full time for an ambulance service and are maybe not around to answer calls while they're at work, and so I think you get more of a sporadic or not consistent ALS response, even in those ALS volunteer agencies. And so something like you're talking about maybe something we have to look at, not just regionally, but statewide, like you're saying, maybe more the model. I mean, when you look at other states and that, I mean, they're much more centralized around the county as opposed to individual localities, and I think that gives them some differences in, staffing perspectives, economies of scale, they're, purchasing, all those types of things that go along with it. And maybe that is something that we need to look at.
Yeah. Another challenge with New York State is the diversity of the counties. Head up into the Adirondacks and see.
Just a little.
Yeah. And what you've got out here in rural Western New York versus what you've got on Long Island or whatever. I don't see a real common solution.
So I don't know that there's a common solution, but I think there's we have many different models right now and probably can streamline it a little bit. The other interesting part about the conversation I most recently had in regards to an ALS first response as a county level, and I forget who mentioned it regarding expense, the ability for a county to absorb some level of expense for a first response or an ALS first response. How many do I need to put out in a county? So, let's say that's four units or 5 units versus putting out how many ambulances do I need to put out with 2 providers on each ambulance, and and fill in the blank. That there might be something that's more tangible to be able to manage. The other interesting part, and this goes back to like our labor force and being able to maintain and keep our providers, is it not every provider can turn and say I have to go pull the helicopter in tonight, and reality is Tom, I'm going to best guess here, you probably do a call or 2 a shift. About right?
Correct.
Yeah. So, I mean, that's pretty reasonable. And look, they even have nice painted little pictures on the back of his wall, like, so clearly sitting in quarters. So is there longevity in something along those lines, and can we maintain some more people for a longer period of time because of that? Or is there not, and I go back to even just looking at the commercial side, where the commercials turn and say, right now it's very difficult to get EMTs because there was a shortage and we didn't train 30%, of last year and everything else. But when you really talk to them, it's the ALS providers, regardless of what level, that become harder to staff, because whether it be they're bouncing around from place to place, or there's not as many of them, or they leave to go to fire or police for whatever reason, that, is there this dynamic that would help stabilize the system as a whole? And we look at some of our really successful, even agency-based models. Look at Port Jeff down in Long Island. Their paramedics or their ALS providers are in fly cars. Their BLS is primarily volunteer, and they're in the ambulances. But when you're hired as a paramedic down with Port Jeff, you're hired and basically told you're part paramedic, part mentor, part instructor, because they truly look and say, we understand that we have a young population. And I say young, I mean young in years of service as an EMS provider, not necessarily age, on our ambulances, and the paramedics are there to coach them through, a difficult call or whatever. I mean, it may be a BLS patient, but if they're not comfortable with it, you're riding with it anyway, and, kind of build on that model to a certain extent. And so, that's, part of what it is. And again, just looking to kind of see where things are. Tim, I think you run an agency, correct?
Mm-hmm.
So I guess my question would be from your side.
I try as best I can.
Give me like the 30-second high level, what your size of your agency and what it's about.
Me personally, I think we're a flagship for the state to look at. We have a very good partnership between the commercial ambulance service and our city. We provide 911 service, fire-based. And so our staffing level supports the fire side of things, but while we're not fighting fires, our crews are up providing paramedic level ambulance. If we are unavailable to provide that service, then the commercial ambulance service provides that for us. Actually, 3 years ago, we used to do hospital discharges to our nursing homes, and because our 911 volume got so expansive, we gave that up because we knew we had to, our main thrust is to support the 911 market. Commercial can schedule those transports, and it makes us more efficient. And we back them up as well. If they can't see your operations. What's that?
And I got to see your operations when I was there.
Yeah. For example, like we're seeing an increased amount of mutual aids that we never did before. For example, if Trans Am's fly car is not available and they have an ALS criteria call somewhere in their protection area, if we have a crew available, we'll send our ambulance out and dump our paramedic off with the volunteer or other agency to support them. So we're very fortunate. We have a very, some areas of the state you don't see commercial or private agencies work with the municipal services like they do. They always think they're at war with each other, and that's not the case. At the end of the day, it's all about the patient, and it's taken a lot of walls to be broken down, but I feel very fortunate to live where we live based on this system.
And I mean, in the grand scheme of things, and to have a career fire department, which is, something that a lot of the state would dream of, and they just financially can't get there.
Well, let me just add another thought here, as long as we're talking about this and the synergy between a fly car and an ambulance, or whether it be county-based or commercial or whatever, and the manpower shortages that we're facing. And one of the impediments that we're dealing with, I think, is policy 1206 and what mutual aid really is. And from this perspective here, that's got to loosen. It's working very well here to have neighboring departments assisting neighboring departments, which doesn't always conform to 1206. But that's how you take dwindling size departments and keep an ambulance in the community, because we're going to need that ambulance, if not just for that community, for the next MCI that happens. And that needs a hard look at. And that's a topic of discussion that, as we're talking about developing our mutual aid plans and how they tie into the inspections that Ed will be doing, et cetera. There needs to be some give and take, more so than the way it's 1206 currently mandates.
And I would say if you would like to draw up like literally a short one pager with 10 or 12 bullet points on it of suggestions, we are looking at a lot of our policy statements right now, in part just because many of them are outdated. When they were developed, like I know the famous policy everybody would love for us to look at is 0606, but we're looking at all of them. Yes, Mickey, we see you shaking your head. But we're looking at a lot of them. So if there is something and particularly if they're not heavy lifts, the tough part is that some of our policy guidance is based off of our statute. Our statute is from the 1970s, and we're forced into certain things. So the other big push that we were pushing for right before COVID was for regulatory reform, and unfortunately COVID just halted everything, and we're now starting to get back to it. The first set of regulatory reform will happen on the education side, though, because education regs are just they just don't align with what we do today, and so that will be step one.
Great. Well, our Stock County Systems Committee is looking into that for the council, and I'll put this on the agenda. Thank you.
That'd be great. Yeah, and like I said, short, sweet. Feel free to even pull the policy and throw some notes on there or something. Any of those would be fine, and we're happy to take a look at it.
Ryan, I think another aspect that you have to look at with the system is these local hospitals, they're transferring a larger number of patients on a regular basis. And our system's already stressed to handle the 911 calls and handle the other things. Now we're transporting patients that for years were taken care of at the local hospitals, that as these hospitals become part of a system, they're transferring them to the mothership, if you will. And that's tying up ALS providers for 4 or 5 hours in our region just to move patients to the bigger hospitals. And I think that's really something that has to be looked at, because it really puts a toll on the system.
So I think that's only going to get worse and I can't even say that will get better, because reality is as health systems start to align more, they're going to turn and say, it's not economical for us to have every regional hospital have fill in the blank procedure. So it's not as much about how do we discourage that, because I think in some cases it's not even something that would be beneficial to discourage or things that would happen on a local level, but more what needs to happen in that transferring. Do hospital agreements need to be something different than what they look like today, because of that? And that's part of being part of a more global system. Look, I come from the hospital world, and it's where I spent the bulk of my time. And in part, in some of my years, I was a partnership with the hospital world. So I was working for a commercial ambulance who was dedicated to a particular hospital. Part of our compensation per year was specifically for movement of those patients, so that we didn't have an issue with it. And that might be as systems grow larger, teaching them about some of the expenses that come along with it and what those relationships look like in order to be able to move those patients, in a reasonable manner and fiscally responsible way. And
Ryan?
have to talk more about that offline, Scott, if you want.
I think you've heard some good ideas. I think that perhaps the idea of countywide EMS in some of the rural areas could possibly benefit from a regional perspective, where we don't have the hard boundaries of county lines. It takes some work on the CON modification probably, but I think you've heard some good ideas, and I think that, like you said, we can continue this offline unless there is someone else that has a burning desire to speak up. We will attempt to.
So the only thing I would leave you with there, Tom, is every county can have a county CON, and the county CON can operate almost to the ability of a non-jurisdiction area. So where they can turn and say, hey, these 8 departments are going to operate under our mutual aid under the county CON, and operate as a county, not county-based system, but county-wide system, opposed to that. And we are starting to see that, particularly in the Hudson Valley area and things like that. So that is something that's important. And ironically, literally today, I was asked, can I come speak to a bunch of county EMS coordinators and emergency managers, specifically to talk about just some of those different options. So we're happy to talk about it, whether it be myself, Ed, Don, fill in the blank. But, you know, those are meetings we're happy to have. And there is not one perfect model. There's not one perfect thing. And, you know, the county system that, you know, we talk about, it's not one model. It's whatever it builds for that particular area that works for both the county and for the smaller. So, you know, look, commercial is going to continue to be a gigantic backbone of our EMS system, balanced by, you know, people always ask me, you know, are volunteers going away? Volunteers will never go away in New York State. We're too big and too much going on, and too many diverse populations of rural versus, you know, big city versus, you know, many different models. So, you know, we just live, you know, kind of continue to walk along. But thank you for the time. Thank you for the feedback. This is, you know, really, really helpful. Tim, you get the gold star for the day for figuring out how to get Muru paid version on every ambulance. Yeah, so that's all I got.
Well, I am always hesitant to point out. Alicia usually texts me and says, Ryan has joined the meeting. And I'm happy to leave you in the background. I don't mean to put you on the spot, but we certainly appreciate your input and your availability to us. You're welcome to any meeting, whether it's virtual or in person.
I don't know if I'm allowed to say it, but motion to adjourn?
I would second that.
All right.
I second that too.
All those in favor, say aye.
Aye.
Very well. Have a good evening, folks. Thank you for your participation.
I have to put my tank in the garage.